All right, well, let's go ahead and get started. My name is George Kakan. I'm the education sector leader at Wightman, and I am a recognized educational facility planner. The town hall, the Wednesdays with Wightman town hall is for best practices in education. We started this town hall about a year ago when we really couldn't go out and see anybody, and all of the mandates had come down from our local, state, and federal governments to keep us safe. And now that we're coming out of the pandemic, we still believe that there's a lot of very good information that we can share. And the reason is to provide a platform for superintendents to learn, become informed, and ask questions, and share their best practices amongst each other and their educational communities. So today we're going to be reflecting on emerging practices, and we have a special guest today from Berrien County, and she's going to talk to us about in-person education during a pandemic and what we can look forward to in the future. Today we also have Greg Monberg. He is the Director of Architecture and is an accredited learning environment planner through the Association for Learning Environments. Greg will be our moderator today, and our special guest today is Miss Nicki Britten. She is the health officer at Berrien County Health Department. About a year ago, she was on Wednesdays with Wightman and also sat on the governor's task force, the School Advisory Council and Student Recovery Advisory Council. So she is looking at this from a different perspective from the layperson like myself. So with that, Nicki, we'd like to go ahead and have you get started and talk to us about the path to 180.
Yeah, thank you so much for having me here and to really share the story of what has happened in Berrien County this school year. When we first started planning for the school year, there were a lot of questions from the outset of the pandemic when schools were first canceled, really back in March and April, and it became evident that the 1920 school year was not going to come to the end that we thought it would. There was immediately planning for what was going to happen next, and a lot of questions around, would we have a full school year this next school year? And if we do, what would it look like? So in Berrien County, we have really been on this journey of trying to get to those 180 days for the pandemic or for the school year. So I wanted to kind of take you through a little bit of the literary journey or through our story, even though this is a nonfiction, this is true. Really the context that we're in, there's lots of different guidances and other things in our context of dictating what's going on with school. So there was the Return to Learn Advisory Council that the governor put forth last summer that created the My Safe Schools roadmap. And schools across the state of Michigan used that roadmap to build their individual plans that were then approved by their boards of education as well. And it was really a guidebook for how to do school in the state of Michigan based on what was both required and what was recommended. But we also know throughout the fall, some of the policies underlying the My Safe Schools roadmap shifted. We moved away from executive orders into epidemic orders. The scope of some of those things changed as cases really skyrocketed in October and November. Some of the tenets of the My Safe Start plan that the roadmap was based on, that started shifting because as we learned more about the virus, we learned more about what happens in communities at higher levels of transmission. That sort of changed what we thought would happen when we got to certain levels. There's also recommendations that are forthcoming from the Student Recovery Council to address everything that has happened this year. And as I stated before, there's just really been a lot of evolving science. We know so much more now than we did last July and August when we were making decisions about the school year. And there's also just been shifts in risk tolerance and palatability and how we go about doing COVID-19 mitigation as a community, as a state. Next slide. But before we get into the story, there's a couple things that were really in place in Berrien County, the preface, if you will, before the real story, that I think have led to a lot of what I would deem to be a lot of success this school year in our county. One of the biggest things is that school leadership is really a team sport in Berrien County. Our superintendents, particularly of our public schools, but we've also gotten our private schools into the fold as well. Our school leaders are meeting very regularly. Starting last March, there was a core group, it wasn't all of them, but there was a core group of superintendents that started meeting every day at noon because the landscape was changing that quickly. The schools have always tried to work with one another, understanding that consistency between school districts actually brings a lot of not only coverage to the leaders as to why they made the decision they did. It becomes easier to do that. It's just easier for families to navigate. In our county, we do have a lot of school of choice. We don't have a lot of families that have kids necessarily in different districts, but we do have kids that might live in a neighboring community going to a district, and understanding why there's differences in rules. It really just adds to the frustration that a lot of families were already experiencing with anxiety and the uncertainty of the pandemic. So the fact that our school leaders were already versed and committed to playing a team sport here was really, really important. Another thing that was working in our favor is that the schools in our local health department have had a good relationship predating COVID. We've already knew who each other was. We had some connections. Our medical director at our health office, or at our health department, has had a lot of that experience working with schools. We had that foundation, that trust, those relationships in place prior to the pandemic. It's always good to know who you're going into the trenches with before you have to actually go into the trenches. And I think that has served us well. And the other thing, just kind of by sheer luck, we have an ISD or a RESA that really is one county, and we have a one county health department, and there's not a whole lot of overlap. We have a couple of districts that do border other our adjacent counties. However, that's not the bulk, or it's not half and half. I mean, we have very little jurisdictional overlap there, and that did make it a little bit easier for us to make some more hyper local decisions without having the impact of other decision makers having as big of impact. Next slide. So I don't know about you, but a lot of times when I'm reading a book, I kind of want to get to the end and I want to know, okay, what actually happened? So we're going to skip ahead to the last chapter. I'm going to give you the overview of why I think that this school year has actually been pretty successful. So in Berrien County, we do have, I believe, 13 public and 25-ish private schools that are educating 25,000 students in our county. We do have the one Berrien County RESA to the one county health department that, again, is really good overlap. In August, September, when the school year started, about 70% on average of students were in person. Virtually every school district gave students an option to either be in person or to be virtual. And so families had to pick what they were going to do for this semester. So about 70% went back in person. 30% chose not to be in person. And then we are now currently up probably around above 80%. Some of our districts are even higher than that, but we've got a lot of the kids that are back in school for this second semester because they liked what they saw that was happening in the fall. We very deliberately chose not to have a hybrid option. All of our schools except one district did have a hybrid option. But the health department, we were very clear that we felt that either being all in person or all virtual was the best option in terms of how that would serve families, but also in protecting the community. School is a very highly regulated environment, and if schools were following everything they put in their plans based on the roadmap, we were confident that there would not be extremely high levels of transmission in schools. However, if we did virtual or a hybrid, where there were a couple days in person, a couple days virtual, and those same students were going back and forth between the in-person and virtual settings, we figured there would probably be a lot more mixing of students beyond whoever they were cohorted with at school on their virtual days. So if parents needed childcare so that they could go to work on those virtual days, those kids might be in a childcare center with kids from lots of other schools. They might be going to grandma's house for babysitting. They might be getting together with their friends or other kids in the neighborhood. And it could be less likely that they would have used masks and maintained social distance in those settings outside of school. It also meant kids from other schools were likely to be mixing. So if there was an outbreak in one school, it would be that much quicker to get to another school because of that mixing. So for that reason, we definitely did recommended 5-day a week in-person options. And we're at 160 plus, probably closing in on 170 days right now that we have made it through with almost with 5-day a week learning option, in-person learning for families, except for the time when high schools were forced to go virtual last November and December. We have had maybe about 250. It's kind of hard to nail down these numbers exactly based on how the data has been collected, but we have maybe 250 cases where school may have been the source of transmission, and we've had 0 hospitalizations or deaths amongst students. When all is said and done, there have been between 12,000 and 15,000 quarantines of students and staff. Got a little bit of a range there because we were not able to deduplicate our data, and we know there are students that have served multiple quarantines, but there have been lots of quarantines following an exposure. That does include exposures outside the classroom, and it appears, again, it's always hard to exactly know, but it appears that a lot of our quarantines, more than half, were due to out-of-school exposures. And especially in the fall, we had a lot of parents that became ill at work or elsewhere in the community and then transmitted to the children. So there was a lot of household transmission or household exposure contributing to these quarantines. Approximately 1.5% of our quarantined students ever became cases. So that is a really low number. We're pleased with that. We didn't want to see more, but that also does beg the question of, is the quarantine as a tool, is it too broad? Because there are a lot of things lost when a student is quarantined and not allowed to attend school. I do believe there is some refinement in some of the guidance to assist with that, to have a more refined tool in quarantine for the next school year. And then we do know that for we have these 250 potential school transmission cases. There were many more cases among students that happened from contact outside of school. So we know that social events and sporting events and all of these things happening outside of school were really driving the cases in our school-aged crowd. Okay, so that was the end of the story. So you got all that up front. In the beginning, and how all of this was really starting, I think is important to go back to, because a lot of this has really been about process and relationship. And so going back to that, you know, there was a lot of work happening in the spring and in the summer to try to understand what was going on, understand COVID, the role of children in transmission, and then planning for a school year, because come August, we really had not done any schooling in the pandemic because schools were closed so early in the pandemic. So in the springtime, even before we had cases in Michigan, even before schools were closed, we were working closely with schools to develop plans of, okay, if this happens, we'll do this. If that happens, we'll do this. And then as soon as we had a really good plan in place, the governor, through executive order, closed all of the schools, and we didn't need those plans anymore. But we were able to continue that connection throughout the spring, which in the summer started with weekly meetings between the health department and school leadership. And those meetings really consisted of reviewing the data of what we're seeing epidemiologically, having very frank and open discussions about what does this mean? What does this data really say? What guidance do we need? What's happening? And I think there was also just a lot of listening. We needed to hear, as the health department, we needed to hear what the schools were going through, what they were experiencing, what they were hearing from their staff, from their stakeholders. And at the same time, they were listening to us and how we were trying to approach decision-making, how we were interpreting things that were coming down, so that we really had that authentic understanding. But then it also created a space for some peer learning. there were things that certain schools were implementing or trying or had read about, and then they had that space to share it with their colleagues, run it through what we as the health department thought about it. And it was really this place to foster that type of collaboration. And again, we were able to make sure we put the school in the context of the whole community. Then moving into the start of the school year in the fall, that was a time when a lot of districts were coming out with, okay, here's what we're doing. Detroit Public Schools says we're going to be all virtual. There were some other big school districts who were saying we're going virtual. Others were announcing plans to go hybrid. We had talked about not going hybrid because of the impact that can have on community transmission. And there was just a little bit of hesitancy of if we start in person and nobody else is doing it, what does that mean? But when we were looking at the data, we were averaging 8 to 12 cases per day in our county. And so we all kind of made the decision, if we're not going to start now, when will we ever start, especially if it's predicted to get worse as the weather cools down? And we saw that it did. So we were really able to link arms and do that. And because of the strength of the team of our school superintendents and leadership, there was a willingness to say, okay, we're going to chart our own path here. And yes, we see that everyone around us is doing something different, but we think we can try this. Let's try it. And so there was a lot of buy-in that had to be garnered from boards of education and staff. This comes down to relationship again. How do we listen to concerns? How do we help them understand where our decision-making is coming from? And ultimately, what I think boiled down to the success of our school year is in the beginning, when it was really nerve-wracking, we gave teachers an opportunity to connect with students in person. And our RESA superintendent, I believe, is the one who kind of floated this idea by everybody. But to start with, we eased into the school year. The first week, it was, every other day, half days, depending on your last name. And we did a little bit of a hybrid approach for that first week or two. But all the schools were really focused on just relationship building between teachers and students. And once the teachers and the students and the parents saw that everybody could interact with one another, could form those relationships, could probably learn effectively in a classroom with a mask, by week 3, everybody was really hit the ground running and was feeling really good about where they were. We also had to do a lot of clarification amongst roles of what school staff were going to do, what health department staff were going to do in terms of when we did have cases, what would the investigation look like, what did that mean? Obviously, the first time there was a case in a school, that was a really, really big deal. There were a lot of people paying attention to it and talking to it. But once we all figured out our lanes, we clearly identified the roles, we were able to roll with it, and it didn't feel quite as dramatic when that happened. And now it's old hat. So next slide. So I'm sure you all can think back on how the fall of 2020 went and then into 2021, but the plot definitely thickened. We had that really great start in September, had that 2-week easing in period, and really just had everybody practicing the mitigation measures. It was a lot to have cohorted students wear the mask, do the hand hygiene. Everyone got a really good, strong start in September. And I don't know how well you all can see it, but on the screen, I've kind of superimposed with that gray line, there's that epidemic curve. This is actually showing our case rates by that timeline. So that's what it was very flat and low there in August and September. We had the big spikes, October, November, and then you can follow it thereon. So October and November, that's when it was like, okay, we've been practicing these mitigation measures. We figured out what to do when we have to exclude ill students, when we have to do quarantine, when we do all these things, we're ready. And then we had the increase in cases in the community, increase in cases in the school at the same time, as you would expect. But our schools did a great job of really staying the course and stayed open longer than we thought, or more than we thought we would. Back in August, we thought if we had hit certain numbers, we would have closed. That was not the case. And I'm really proud of all of the work that so many staff members and leaders and families really did to maintain that in-person education. In January and February, that was following the high school students that had to go mandatory virtual. So getting them back into that in-person rhythm. we added in the complications of, okay, we're going to play sports and there's testing protocols and there's all these sorts of things. And come January, our RESA actually had hired some staff to assist with contact tracing and notifications and questions of students that had been exposed. School staff was helping health department staff do that, but that was becoming a bit overwhelming. So we're very grateful that our RESA found some funding and was able to hire some staff that they still have on board and are still assisting with this. And then in March and April, in the state, there was another increase. You can see there in our line, and that line really ends at the mid-May. So some of that increase is there in March and April. In Berrien County, we did not increase anywhere near as high as the rest of the state did. Not 100% sure why, but grateful for that. But we really were watching and waiting for the other shoe to drop. But the continued diligence in all the mitigation measures, continuing to have really good communication. This is when a higher proportion of cases were younger, and there was all the stuff in the media about, oh my gosh, kids are getting sick. In some ways, it wasn't that kids were getting sick more than they were before. We just didn't have infections happening in our older adults because they had been so well covered by the vaccine, particularly in our county. So it was we had to really understand and analyze the data and really understand that and adjust the playbook, because when it's 20% of cases are now those under the age of 18, that feels different than 7%. But looking at that in total and how vaccination has changed our interpretation of data is important. And then here in May and into June, we're really trying to finish strong. There's a recognition that the stakes can be a little bit higher in that last month of the school year when you've got, especially for high school students, there's exams, there's AP exams, there's graduation ceremonies, and lots of different things that can't really be made up because one, there's no more school year left, and two, there's some once in a lifetime events. So recognizing those higher stakes and adjusting, again, the playbook as necessary to do that. And kind of those themes, those motifs that have been woven throughout all of this is it's really about watching the data. It's about strong communication that involves both telling messages, speaking, but also listening and really making sure people, whether it's families, staff, school leaders, our health department staff, making sure everybody's concerns are heard and maintaining that relationship. Public health moves at the speed of trust, and that has been a thing that we have really needed to maintain throughout all of this. Next slide. And then I wish it was just this nice, neat story and the plot had completely wrapped up and we were done, but there's a lot of unresolved threads in this plot line, and I think we're going to be spending a lot of time trying to plan for and as we start thinking about next school year. But I kind of mentioned this before, but more finely tuned tools for quarantine. Quarantine has cast a really, really broad net, at least in a school setting. And we're finding that the vast majority of people quarantined, they're losing their in-person education days, but also not becoming infected. And so how do we adjust that risk benefit analysis and how we do that? However, isolation and quarantine do become increasingly important public health tools as case levels drop. Stamping out those lines of transmission becomes more doable and easier with those tools. But we want to maximize those in-person learning days. We muddled through for one school year. I don't think anybody wants students to have to muddle through a second year of their schooling where at the drop of a hat, you might just be gone for 2 weeks. Even though we really tried to focus on this, and I think we have done a good job, there continues to be a need to really just strengthen credibility and relationships. Having some clarity on what the path out of mitigation measures looks like will help, as we've all seen in the last week with changes of who wears a mask and when do you not wear a mask and what does it take to not have to wear a mask. All of that has led to a lot of confusion. And when people don't feel like they know how decisions are being made and what that framework looks like, it's hard to have that credible relationship. But I do think that there's a lot of space to be able to reunite for that common goal of quality education for our students. And then we all know, I know this isn't going to be news to anybody here, but social and emotional learning and mental health supports are really needed. This has been a really trying year. And I will add that this is for school staff too, not just the students. This has been a really, really stressful time for everybody in the system. I think on the whole, everybody's done a fantastic job, but we don't want to gloss over the fact that this has been pretty trying. Next slide. And then we do hope to have a sequel. We want to get to 180 again next year. And there will definitely be some different things that help us. We know just last week with the approval of Pfizer for use in children 12 to 15 now, so 12 and up can be vaccinated. That certainly changes things, and that changes what a school landscape, especially at that middle school and high school level, might look like. We do expect come September is the latest that I'm hearing, that could be when we have approval for 5 to 11-year-olds. So the beginning of next school year, it might be possible for all K through 12 students to begin the vaccination process. And again, I've said this a lot, but it's the trusted and credible relationships. And some of this is to build consensus on that risk tolerance. We have some people that are completely and totally fine with all the COVID risk, and they would rather see no masks, no testing, just let the kids have a normal experience. And we have others who still do not want their kids to be in a classroom setting because they are concerned about the risk. We don't have societal consensus on what level of risk is tolerable. And that happens with new things. And I think as time wears on, we'll get there, but that continues to be important. And then we need to be able to just more clearly define the risk benefit calculations we're making when we say we need to do this mitigation measure, but it also has this expense. It's been much easier to define the COVID risk and then therefore the need to mitigate it. It is harder to define the learning loss that comes with 6-year-olds not being able to see their teacher's mouth when they're learning how to, that's part of learning to read, is seeing somebody's mouth moving. So you can't calculate that cost per se, but it's there. And does the cost of that outweigh the benefit of the COVID mitigation? There's no clear answer to that, but there needs to be more dialogue. And then just again, more robust supports for school leadership and staff, as well as students and family. That's one of those unresolved threads that needs more resolution going into the next school year. Resilience and just kind of muscling through difficult situations, because you know it's short term, can be done, but when it starts to really wear on, it definitely has an impact. So I'm hopeful that we'll be able to get to 180 again next year as well, and continue with our in-person learning options. But I'm grateful to be able to have shared our experience with all of you.
Well, thank you very much, Nicki. That was very insightful. And I think I felt just about all of those things. So Greg, if you want to take over.
Sure. Well, one of the questions I had was based on everything you've learned over the past year. If you could go back to March of 2020, what advice would you give yourself on what policies we should be following and what has worked and what hasn't?
That's a great question. Maybe this isn't exactly what you're asking, but honestly, I would go back. If I could go back to and influence what happened in March 2020, I would have taken a slower approach to closing down the schools. Now, hindsight is 2020. We didn't know what was coming, and it looked real daunting, and we didn't really understand the role of children in transmission and how it impacted children. So I don't want to stand here and second guess that here, 14, 15 months later. But I think in the public's mind, it was equated, if there's COVID transmission happening, school is not a safe place. And it has been an uphill battle with some parts of our population to really break that association and determine how school can be safe. So I think that would that would certainly be the thing. And I think, again, just thinking through how do we better support students as they move in and out of quarantine? Because I think our schools did a really great job of having a virtual option and an in-person option. There was a lot of variety as to what the quality of education looks like as students had to sit out for 2 weeks for quarantine. And some students, depending on their grade level or their district, were able to kind of keep going without missing a beat, and others were basically absent for 2 weeks.
It seems one of the big challenges in dealing with this whole issue over the past year has been building consensus and building awareness of what the science says about what is safe or isn't safe, and what individuals' risk tolerances are, as you've mentioned, especially for things like children getting vaccinated and having kids, 5 to 11 being vaccinated. Are there lessons learned about building that public consensus that might apply to the next time if we have a pandemic in the future, about building that public awareness that we should do differently, or how should we approach that?
Yeah, it's been interesting because, I mean, there's a lot behind that. One, I think some of it is just depends on, is the relationship and the trust in place before the crisis begins? I think as we look at some of the variability between communities across the state and across the country, you can see where there were existing strong relationships, say between schools and public health prior to the pandemic, and then others that were trying to forge that relationship during a time of crisis. And not to say that the latter can't be done, but it is a lot trickier. And as we've seen, a lot of people just are not at their best. And are already stressed and strained once we hit this pandemic with all the extra things that it added. So building authentic relationships and thinking really innovatively and all that is just harder in crisis. So I think having a constant focus on those authentic relationships across our public health spectrum, across our education system with all the stakeholders is incredibly important. So a focus there is very important. Yeah, I think that's one of the main things. I think too, it's interesting because part of what has led some members of the public to have some distrust for the public health guidance is that the guidance keeps changing. But that is also the scientific process. When you learn more, you do something different and you iterate. And so some general understanding that if the guidance were the same today as it was last April or last March, that's when you should be more concerned than if it has changed 15 times since then. And I think that's just a tricky thing for people who are not immersed in that professionally.
And we had talked last year about getting to a new normal and building around best practices. There was a lot of discussion about how to maintain social distance in schools, whether or not children needed to wear masks, hand hygiene, and all of those things. What are the best practices at this point for maintaining a healthy environment in the schools? What should we continue to do, regardless of whether there's a pandemic or not, I guess?
Yeah, so I mean, so I don't know if you'd want to keep this when we come out of the pandemic or even when we define, I'm not sure when we're going to be able to even draw that line, but masking right now for unvaccinated people is definitely important. Will that become the future of just, because we had very low influenza rates and fewer colds and flus. I know some people have been speculating, maybe we should keep masks on every cold and flu season. I don't think that that's something that will become a requirement, nor do I think it will become standard, but I do think that it will probably become more common for individuals who might feel like they have a little bit of a cold and still go to school or go to work. I think those individuals might put a mask on themselves while they're feeling that way. I mean, pre-pandemic, we've all gone to work feeling a little bit under the weather. We shouldn't. You should stay home when you're sick, but we've all had to do some of those things. It might become normal if there's a student who's got a little bit of the sniffles or something. Maybe that kid is asked to wear a mask that day, or that's something that the parents could choose to do. So that might be there. I think the dedicated hand hygiene and all of that is, and utilizing the outdoors more for some outdoor space. I think those are going to be things that probably are just good in general and could be with us.
And that's generally been the case with schools. They tend to be safe places otherwise because there's so much training of the students to do of what they should be doing in any given situation, whether it's a tornado or fire drill or things like hand hygiene had been certainly a regular practice in schools long before the pandemic, making sure kids wash their hands when they go to the bathroom or before they eat lunch. That became part of the culture of schools, I think, a long time ago. You mentioned, though, the cases of flu, and do you know what those numbers are? I mean, nationally, it seemed like there was a big drop off in flu cases generally, but also among children. The number of kids getting severely sick from flu seemed to drop off this past year quite a bit. Is that the case? And why was that? Was that because of all the other things we were doing about shutting down significant events and super spreader events, or personal hygiene and mask wearing, or something else? Or do we know?
Yeah, so I don't have the data to give you hard numbers here, but we definitely saw a dramatic decrease in the amount of influenza. Now, there wasn't as much influenza testing happening because either people were not seeking testing or they sought a COVID test if they had some respiratory symptoms. So there could be that out there, but influenza is also spread through droplets. It's a respiratory virus, just like COVID-19. So all of the things we have put in place to minimize the spread of COVID-19 will also very effectively reduce the spread of cold viruses and influenza. So the masks that contain respiratory droplets will mean that there will be fewer that are going into the air. So if you do have influenza, that's not going to be happening. Good hand hygiene is really important, so that if you do touch a contaminated surface, if you just wash your hands, it's no big deal. Staying home when you're sick, people are being a lot more diligent about that these days. So that helps stop that transmission. And you're right, just not gathering with large groups of other people, not being around, all of those things will also reduce influenza and other respiratory virus transmission.
And with vaccinations, is it likely that kids 5 to 11 are going to be expected to get a vaccination for COVID within the next year? Where do we stand on that relative to recommendations and research on kids being vaccinated?
Right. So there are clinical trials underway right now that are evaluating the vaccine. I know for sure Pfizer is doing these trials. I believe some of the other manufacturers are as well, but for children 6 months and older. So clinical trials are underway. And with the timeline of those studies, the expectation is that the data would be prepared to take to the FDA for potential approval for that 5 to 11 age range come September, and then the 6 months plus by the end of the year, so maybe December or so. Now that timeline could be subject to change. So that's approval for emergency use authorization. That's different than a requirement. Right now, all of the vaccines from all manufacturers are approved only under an emergency use authorization. That's not full FDA approval, although that is in process right now, I do believe. So I don't think that any public entity like a school would be able to require the vaccine while it is under the emergency use authorization. but it could definitely be recommended. And there might be changes in mitigation measures required of schools based on the percent of students that are vaccinated. Those are all things that could be in place. If and when the vaccine does get full FDA approval, that's when requirements could start coming into place. But I'm not 100% sure how that would play out, how that would land politically. I think there's a lot more to be determined by that point in time.
So until that point in time, what are the likely recommendations to be over this next year for students if they do seem to get sick? Is it for them to wear a mask or to stay at home and to continue with quarantine, or if they aren't vaccinated? Or what should the policy be, and how do we get to a policy for schools until there's full approval?
Yeah, it's really hard to say what things are going to look like come August and September. So with that caveat, if we had to make the decision today as to what next school year was going to look like, I would venture to say that the policy would more likely require masks to still be worn if you're unvaccinated. If you're fully vaccinated, to not be masked. So unvaccinated students would need to be masked, that there would still be an attempt at as much social distancing as possible, especially in a school that doesn't have 100% coverage, and I doubt any of ours would have that. I think that there would still be the attempts to do cohorting, although it might be a little bit less rigid, but trying to reduce the number of students that are interacting with one another. So I think all of those would still be in place. There may be some changes, and there's some talk about this. There's some research emerging from CDC, but of trying to reduce the distance between, or I shouldn't say reduce the distance, but you're considered a close contact and exposed to a COVID case if you're within 6 feet of that person. But in a classroom setting, if masks and other mitigation measures are in place, we're finding that very few of those people, especially in the 3 to 6 foot range, are becoming ill and infected. So could allowing those students in that band, the 3 to 6 feet away from a case, could allowing them to continue to come to school help refine quarantine as being more useful for maximizing in-person education while still not really throwing off our COVID risk. So I think there will be some adjustments in how students might be excluded, how risk of transmission might be evaluated. But I think a lot of those things are all, they all are resting on the assumption that masks are being worn in the classroom. So if the masks get tossed out, there might be some of these other things that need to become more restrictive. So it'll be interesting to see. A lot is going to change over the next 3 months. And I know that makes people anxious because they want to know how to plan for next year, but we're going to continue to have to do some planning, some waiting, some adjusting.
It's certainly a time of a lot of anxiety, like you've mentioned, and providing that social and emotional support for staff and students is especially important. Certainly that trust building for what the future is going to look like, and what policy should be in place. But it feels like we're in a much better place right now than we were a year ago in our understanding, and in the level of safety, and in the availability of the vaccines that are on the market right now. So
yeah,
it feels like there's certainly reason for optimism.
I would agree. There's a lot of hope.
Greg, thank you for the great questions, and you stole a couple of my questions, but I'm glad that you asked them. And then I think Jeff Leslie is on the call. If you have a question, please unmute your mic. And I was just going to go ahead and wrap up today's session. If I can get to the right slide. So I think one of the things that popped out at me that just for whatever reason it didn't really hit me until you actually said it today, Nikki, and that was I've heard a lot of conversation over the past 12 months. Either we're all in and we're all going to school, or we're doing it virtual. And what you mentioned in your presentation and your story today is that it was either one or the other, and that the hybrid created other problems that I had never even thought about, in relationship to students being exposed at multiple levels beyond either just being in school or just being at home. And I thought that was very, very insightful. And, I think a lot of this, we really just come right down to it, and you mentioned it, that we have learned a lot more, we have a lot more information, and that, the decision making and the directions that, were given for school districts and, just the general public have evolved. And that's a good thing. And I agree with you with that. So again, thank you for being here. And I see that Jeff Leslie is on. Go ahead and ask your question.
Well, I guess I don't really have a question. I just wanted, for the group, that I can't overstate how important Nikki's guidance and leadership was throughout this whole process. I mean, when we met as county superintendents with Nikki and her staff back in August, and there was a lot of debate about whether we were safe to go back in person, whether we need to be remote or hybrid. But, that one meeting made a huge difference in the lives of kids when she made it very clear that there's no reason why we couldn't go back in person. And now that we're here towards the end of the school year, we're getting our M-STEP results back. And I think about, the fact that we were in person this whole school year, by and large, my seniors that are taking AP exams and the results that they're getting that they may not have gotten if we were hybrid or if we were virtual. I have 0 third graders that are going to be impacted by that third grade reading law. And I don't know, I will never know if that would have been the case if we'd have had been hybrid or if we'd have had been virtual. So I just, once again, want to thank Nikki for her courage and her leadership throughout all of this. Thank you.
Thanks, Jeff.
Well, Nikki, great job. And I'm getting towards the end of my career, and it looks like you still got a little ways to go. So keep doing what you're doing. And we really appreciate you coming on from Wednesdays with Wightman and our team. Help keep us all safe, especially our students, because that really is our future. So with that, I'd like to just thank you for coming on and the guests. And I just want to announce that on June 16th is our next town hall meeting. And Nikki, you may want to jump in on this one, because I think you may be able to offer some opinions. But in this, as we're moving into the post-pandemic era of what's been happening, we're going to have a couple of national guests as well as folks here from Michigan to talk about what schools are going to look like as we move forward. And I think today was a really good look back and a stepping stone into the future. So thank you again, Nikki, and good luck with your career. And hopefully we'll run into each other again soon.
Thank you.
All right. Take care. And thank you to our guests. Bye, everyone.